What if an AI could predict dementia years before any symptoms even start to show? That's the incredible idea we're diving into today. We're looking at how artificial intelligence is being trained not just to predict one of the world's biggest health challenges, but to actually explain it. To really get why this is so important, we have to start with this number, 139 million. That's how many people are projected to be living with dementia worldwide by the year 2050. It is a staggering figure, and it represents a huge challenge for patients, for their families, and for our entire healthcare system. So when you're staring down a number that massive, the question becomes pretty urgent. What if we could see it coming, not just when the symptoms are obvious, but years ahead of time? This is the promise of AI, and it's really the heart of the breakthrough we're going to explore. But before we get to the AI itself, we need to understand the complex problem it's trying to solve. You see, dementia isn't just one single disease. It's a massive global health crisis with a really profound impact. It's a progressive disorder that causes this cognitive decline that goes way beyond just normal aging. And its impact, it just ripples outward, affecting not only the patients themselves, but their families, their caregivers, and really the whole healthcare infrastructure. And that is exactly why predicting it early is such a game changer. Now, scientists have been using AI to tackle this problem for years, but they keep hitting the same major roadblock, what's known as the black box problem. Okay, so on one side, you've got your black box AI. It might spit out the right answer, but you have absolutely no idea how it got there. The process is a total mystery. And for a doctor who has to make a life-changing diagnosis, that's just not good enough. But on the other side, you have explainable AI, or xAI. It doesn't just give you an answer, it shows its work. It makes the whole process transparent. And that builds the trust that doctors need to use these tools in the real world. And this is exactly what the researchers behind this study focused on. As they put it, they really wanted to get past the limits of those older black box models. Their goal wasn't just to be accurate, it was to create an AI that was truly understandable. So how did they pull it off? How do you actually build an AI that can not only predict a disease as complex as this, but also explain its own thinking? Well, the foundation of their model is a pretty well-known statistical method called logistic regression. Now, don't worry about the name. Just think of it as a tool for making a simple yes or no decision. In this case, it was trained to answer one crucial question. Based on all the data, is it likely this person has dementia? But here's where it gets really clever. They added a two-step process to make the AI both smarter and way more transparent. It's kind of like training a medical detective. First, you teach it how to find the most important clues in a patient's health records, and then you make it explain exactly how those clues led to its final conclusion. So step 1, finding the clues, uses a technique with a fancy name, Recursive Feature Elimination. But really, all it does is sift through tons of patient data over and over again, and it systematically throws out all the noise and the irrelevant details. It basically learns to focus only on the handful of factors that really, truly predict dementia. Step 2 is all about explaining the reasoning, and for this, they used a tool called SHaP. This is the part that forces our detective to show its work. For every single prediction it makes, SHaP reveals exactly which clues were the most important and by how much each clue pushed the diagnosis one way or the other. So, after training this super smart AI to focus on the right clues and to explain itself, the big question is, what did it find? What are the most important predictors? Just think about it for a second. With all the possible data points out there, from genetics to lifestyle choices, what factors do you think the AI would latch onto as the most critical clues? And here are the results. This chart ranks the most influential factors it found. Right at the very top, with the longest bars, you see cognitive test scores, the number of prescriptions a patient is taking, and their depression status. These 3 factors were, by far, the most powerful predictors in all the data. Now this chart, this gives us an even deeper look. It shows the impact of these factors for every single patient in the study. Each dot you see there is a person. And the further to the right a dot is, the more that factor pushed the AI towards a dementia diagnosis for that specific individual. This is what real transparency looks like. The AI isn't just giving a broad summary, it's explaining its reasoning for each and every case. Okay, so the model is transparent, and it has identified the key predictors. But how well did it actually perform? This is where the results get truly remarkable. The final accuracy of the model was 99.5%. Let that sink in. That is an incredibly high level of accuracy, especially for a condition as complex as dementia. To put that number into perspective, it means that for every 200 predictions the AI made, it was correct on 199 of them. The margin for error was just incredibly small. And here's the raw data to prove it. This chart basically shows the AI's report card. The numbers in the blue boxes, the 94 and the 105, represent all the times the AI got it right. And that little 1 in the corner, that represents the single time it was wrong. That is a stunningly effective performance. So just how good is 99.5% really? Well, this table compares the result to other recent studies in the field. And while previous models were definitely impressive, getting up to 96% accuracy, this new method just stands head and shoulders above the rest. Their specific combination of techniques wasn't just a small improvement, it was a major leap forward. So why does all of this matter? Well, it points to a future where we can detect dementia earlier and more precisely than ever before. A future where doctors can create personalized intervention plans for patients who are at risk and where our healthcare systems can better prepare for this growing global challenge. And that brings us to a final, really powerful idea. This research, it focused on dementia, but the principle behind it is so much bigger. When we stop building AI that acts like a black box and instead start demanding AI that can explain its own reasoning, the question becomes, what other complex problems could we finally begin to solve?